earlier than I thought.
That's why I was giving you grief. I was like, geez,
What the heck is he doing? You're not
why
really.
is he so early?
I know, I hate that.
I was just mostly giving you grief because it was fun. Because it was fun, because we could.
Because
So
that was an easy target. Yeah.
It was kind of easy. And I figure anyone who's gonna wear patterned socks can take a little ribbing.
Hey, I earned the right to wear those. My boss at my other company just gave me so much grief about that. And the president of the company one day comes in, he goes, everybody needs to start wearing those socks.
Nice.
They're called Happy Socks, is the actually the brand name.
I wear the blue Q, which has all kinds of inappropriate statements on it. Okay, so Raquel, I am seeing your screen. So when you get ready, you want to maximize your PDF so that anything that's in the background is less visible. Yeah. Okay. I'm too old for getting
That's
better
full
now.
screen, wait a minute.
Oh,
No, that's fine, should be good.
yeah, should be fine. Yeah, I just want to make sure it wasn't showing that.
Nobody else.
Yeah. Okay, you're good. Oh, and it shows the recording
Yes.
is here. Okay, so you can pause recording unless you want to see it running. It doesn't really matter. We just
Oh, and it automatically
starts recording.
starts recording once I start the meeting.
Okay, perfect. So then,
Yeah, auto record.
are you gonna just scroll through the packet?
Mhm.
Okay, so remember, don't get hung up in your consents.
Yes.
Okay. Well, we took the old financial data consent, so we're not losing people in that process. And see, what a good board member. Look, he brings his packet.
So great, oh my goodness.
I'm gonna assume you've actually read your,
No, I didn't print the whole thing. I mentioned that to you at the finance committee meeting.
Totally
'cause
not
it's
necessary.
Too much, but I certainly brought the business end of it.
all right, good. You'll see you got your business cards. That's what those are.
Awesome.
So Tracy has one box that she will keep for the 2 district offices to have those filled.
Okay.
Okay, so if you should run out,
Hmm.
know that we've got some here.
Fair enough.
And then when you get down to your box being almost empty, just let Raquel know and she will make sure that we get them ordered.
Okay, excellent,
What else do we want? Board portal is coming.
Board portal is coming.
So they won't be emailed to you anymore after this month, all your reports and things. Because we've got the portal up on our website. So
Okay.
when we do our training on the 21st,
Mhm.
I'll show you guys how to access from there. And then you can go in there and you'll be able to see last year's committee reports, last year's board meetings. And then this way, as we go through this year, you'll say, oh, what was that last month? You'll be able to go in and pull or look at last month so we can keep a running history
Awesome,
without stuff clogging up people's emails.
excellent, excellent.
I don't know, is that okay?
Oh, it's tiny.
It is, right?
So am I just gonna need to read the finance committee meeting or Jennifer do that?
Nope, it's gonna be you. It's all you now. So if you have your treasurer's report, yep, I would follow along there.
I'm gonna try to enlarge it.
Okay.
Closing all my stuff on the computer.
Okay.
Okay, so,
Well, oh, that's better.
oh, much better, thank you. Okay.
Yeah.
Good deal.
Good, all right. I know, I do that. I need to get a little pad so I can put my old knees on these things. You want to prepare yet?
No.
Okay, no. I directed her back to the website for the packet in English because you had sent her it in Spanish.
Oh, I didn't want it.
She asked if we had it in English and I was like, well, yeah. And I said, well, you can find both on the website.
Mhm.
You can find the link on the website. And then she found the hyperlink in the packet, so. Okay.
Awesome.
Yeah. And I don't need all this room, so if you want to put your other
Oh, okay.
folder, because it looks.
Thank you. I was.
It looks a little,
It was hanging. Oh, right.
that way you can have all that space. I should be fine here since I don't have my computer. I'm a little lost. It's a good thing.
That's you. Your form 700.
Thank
Go
you.
through that and page 5 is where you sign.
Okay.
In case. Barbara already picked hers up. Carrie got his.
So I need to fill all this out.
No, you don't need to fill all that out. All I really need from you is just your signature on page 5. And if you have no reportable interests on any schedule, properties, and I guess they're asking for investments and loans and so if you'll see there, depending on what you want to claim. So the majority of the directors report none. However, it's a.
So is this a disclose in case there should be some conflict of interest between the district's business and whatever?
Whatever you're holding.
Mhm.
Correct.
Okay, I'm gonna go ahead and sign, but I need to think about that.
Please take the literature with you. And
Okay.
if you'd like, I could just print you up page 5.
So you just want me to sign it, right?
If you can, yes.
Right, yeah, I certainly do.
You're more than welcome to take the other literature and just leave me page 5.
Okay. Sounds good.
Signature on this one as well. This is for that transfer. This one is for you and Bill. Hello. Hello.
Is everybody upstairs? Everybody's upstairs?
I think so, yes.
Yeah. Oh, they fell out of my hand and slipped down. I almost shut the door.
Oh, man.
It was really close.
Okay, I'm good here.
Thank you.
You bet.
One more request, our IT. Gentleman is asking for our board's passwords for their fallbrookhealth.org account. This is in case you ever get locked out or need him to fix something. Yeah. Thank you so much. Thank you much, and I'll be covering it with a
No problem.
sticky note, and keeping it private.
No problem.
Has the interpreter showed up in participants yet?
No,
Well, it's just now 5:30 though, huh?
yes,
Oh,
just a
5:37.
little past.
Should show up.
Yeah, she should. Yeah, you said 5:30.
I did.
Yes.
I'm returning your pen to you, Rachel. I don't want to be accused of
Absconding?
But-
Okay,
her pen.
listen,
That's
we'll
a-
hunt you all down.
That's a bad reputation to get. Yeah.
Being known as the pen thief.
That's it.
Jeez, I didn't know we were so hard.
Yeah.
Well, since I'm the only one that uses felt tips, it's pretty obvious when it's my pen. Nobody wants my pen.
That's why I have to stop drinking my drink too.
Hey Terry, how are you?
Hey, how's it going?
Good. Hey, I was thinking today, you know, there's no reason we couldn't just move that forward.
Yeah.
I talked to the carpet guy today. No, you're that one. So I mean, literally, you could start moving these down there as you want. And then, as soon as, I mean, it's not that close.
Yeah.
Because they're not gonna replace that whole carpet section. If they do that, the carpet comes back. I'm like, he's like, the guys do a patch, I'm like, if they can do a patch, I'll just take that furniture, where we can't figure it. Yeah. It's not a back area.
No, it's
Not like you're gonna constantly walk over it. They have to be able to patch that. I mean, so we'll see.
Yeah. Now, when you guys are doing on Monday, we can put the blinds, but I think that's the
No.
last thing.
Your blinds are gonna come in post move-in.
Okay.
They're gonna have to come in post move-in, we're another time. And the blinds, like, when they did the blinds here, they did it in a day and a half.
So they were so quick.
3-day blinds.
Okay, this is the local person.
Like double the cost.
Oh. 3-day blinds, but they were great.
Okay. Yeah,
They were really.
they were fast, they were inexpensive, the local person was, cause we had them come out here, and the quote was like double,
Probably more.
maybe not double.
Okay, makes sense.
I don't remember who it was, I just knew it was the
Yeah, I
local.
just met someone at.
Rotary.
Chamber thing.
Yeah. Is it Fallbrook window and something?
No, it's 3-day blinds. And she just happens to live here.
That might be the lady who came here, but it was 3-day blinds who did it. Yeah.
I remember that lady, I probably have.
I might be confusing the foundation for senior care and here, because I use them in both places. And when I use it, the foundation for senior care is somebody who lived in Fallbrook.
Got married in it? Blinds HVAC. That's, second part is gonna be. There's 2 rooms. You are such a mess. I'm a mess.
I'm sorry, the HVAC for what? What are we talking
The
about?
2. Yeah.
I don't have a date, because I just got a call. Richard? John. Dang it.
Okay, Richard will do the other one.
Okay, I gotta just call John and get it scheduled.
Okay.
So I was just gonna let facilities know, hey, here's what's upcoming, here's what we already have plans, here's the estimated estimated cost, so I just have to put it on the agenda and bring it forward.
That's good, I didn't know that. What process for the massage?
I hate her proposal.
I copied and pasted from. I really thought.
No, I don't mean the format. I hate what she's proposing. I don't know, I just, something, I gotta think on it, it doesn't feel 100%.
I think it takes quite a lot to recognize that. Her specialty is more medical type. So that's the only thing that makes it different than letting anybody. Right? I don't understand.
I was thinking when I take it to,
Because that's what, it's not enough outside.
it's outside the basic scope, but I'm not necessarily just immediately knee-jerk reaction comfortable. So,
How are you?
you know,
Beautiful. How about some coffee, Barbara? Okay, that sounds good.
you know,
Would you like some? Would you like some water? No. That's a really coffee about the source of. Hold on, don't do anything, like this is not a group. This is not.
I mean, I know Shay is super excited and she can support Michelle's place and she can use the room for Michelle's place. But she wants to run her private business out of there. And I'm just not super in love with that concept. So I think we toss it over.
Again, the apple. I didn't really read it through, I thought. But I just.
No, there's no dollar.
Yes.
And it can be too early, yes. Howdy. We'll get you one. Which
Go if you want some coffee.
Oh, okay.
There's some water if you want to pour yourself some water.
Okay.
There's coffee.
Hi.
There's some water.
Good evening, good evening.
Evening.
Hello. Hi there.
There's a box of raisins. I can never bring.
I said, I wish I
Hey,
was.
Barbara. How are you?
And then maybe watching the rain.
Thank you, I'm gonna keep you.
Do you have an extra agenda?
We're a dying breed.
Okay, great.
Yes.
There
There you go.
Oh, thank you.
Hi,
Hello.
how are you?
Excellent, you?
Good, thank you. Would you like something to drink? There's water there, but I can get you some coffee if you like.
I'm just kidding. Okay, appreciate it.
Hello.
Terry, would you like some?
Good
I'm
afternoon.
good, thank
Oh,
you.
they are?
Excellent.
Hello there.
Hey.
How are you?
Hey,
When it's working, it's hard to do.
Come see my husband.
Hey, Mr.
Hey.
Terry, how you doing?
Good, good.
Good to see you. Nice,
Hi, Roy.
start you have there, sir.
You can think it.
Hey, Barbara.
You did
All
it.
right, how are you?
I'm good, aren't you? We're helping you.
Would you like something to drink?
We're
Cool,
official.
you legit?
Good, because I'm gonna get the text.
No, it's not, no.
Excuse me.
Thank
For
you,
you, you're
friend.
welcome, my dear.
Hi, Patty.
So if that's.
Excuse
me.
Is this the Ford 700? Yeah.
I'm just gonna minimize it
Hi.
instead of.
Hey, just see under.
Yeah, that's over there. Right?
Spacing.
What's your video?
Date and time.
Very boring public.
Just keep going, right? It's all good.
No such thing.
You don't have to. There you go then.
What do we say?
So that will always be.
11, right?
Yes, ma'am.
Thank you.
I never even read it.
23. Remember Roberta Flack?
Oh, you bet.
Last night. She's got
Okay.
Oh.
no more before me. But she's
You
really.
remember
some of that? He's actually.
No, I haven't got all of her, but,
It isn't the.
I warned her you'd be
contact.
She didn't give anybody flack, she
Okay.
just gave them some.
Apparently though, Rotary.
Barbara, how you?
Hanging in
And I've got the
Had a
bulbs going back 50
wild,
years now.
Right.
Christmas.
And
Boy
she did say
Scout
it was already
Arizona,
fixed.
and it was like no Christmas tree, no nothing, it was just all
She
attention.
said it's like.
We had a church,
Stop.
but,
And it started up again.
my ex
If you are not
lost
the.
consciousness,
Darn.
fell down the stairs,
No.
we had paramedics come, and all that, and he didn't go to the hospital, or urgent care, nothing. I got.
Right.
So my son was like, "There's nothing wrong with you, Arlen." They're in business
How you
together,
doing?
but he's 9 years, he's almost 10 years now, post-cancer treatment, and
That's
he
the
has
problem I was told those years.
damage
A lot of
to the radiation.
confusion.
Oh,
So he had lots
Are
of
they elected
stations.
somebody to the
It's
county
really
or
half of
just
the
not
body,
like-
and hearing aids and
Right.
stuff. He does want to go in and take care of
So
himself,
there's.
And then he's on library medication,
You've
because
done that
it's
topic,
thyroid.
yes.
I have.
And
That'd be
he's
another
on
interesting
blood pressure.
history of
So
that.
after church, we made
It's a big deal.
breakfast and everything,
for
they were
somebody
getting
to
eggnog.
die away.
Yeah, I was surprised.
And I think it was too much of everything. He started walking up the stairs and he turned his head and went.
Hundreds of horses.
And then they did it last 4 hours.
We were on the call already.
Here is a cardiologist and my lab work and blah, blah.
From what I was
What a
told.
liquid cheese. I think I'm just gonna go back to Arizona and I'll make an appointment and go see the cardiologist, because I don't think he should have put my.
There's a rodeo ground.
Yes, yes. Right, I don't know if they had a rodeo that night.
You can get everything collected and then take it
I
to
think
your
they did. I can't find the story on that. But
But he said,
there was a rodeo
there
ground.
could be a black mark scar tissue. from broad artery.
Right, right.
We have to wait and see, which is the difficult part, because he's always one of
So I
those
said
get
this
around
here.
here. And I don't
That's a
want,
guy that.
I know, but my son is on it now, which is.
I always like
he-
something
he- my- My son is.
That's what it's more for.
Well, I know. They work together.
So
We have the
Will be
rodeo
there.
ground.
You have to hold it.
That one.
And then you have to count. So you gotta get this left. And then he has to.
They won't.
work because-
It won't, because we
Yeah,
have
it was
to
like a
start
secondary.
until the PowerPoint gets
Carry
swirly.
over.
So I get everything.
Oh, he's got a home in Lake Captain.
All that time. There were.
I have a couple of programs. But during your days for a couple
I
of
did it that way.
Yeah.
Regular.
I have it.
Ones on there.
Oh.
Yard that they had, there was.
They could parse it out. Yeah, I'm sorry. I'm sorry. That will remind me next.
That'd be
It's
interesting.
a better.
Yeah, I just happen to like animation, you know, those types of things.
My son was just, I was
Break it
I'll
up.
tell you, it was
You know, all the horses went.
to have.
I guess the whole Western.
And he's like,
Somebody told
you
me
know, and I told my son,
where Australia's is on the South Mission.
you don't have to.
That's okay.
It's a vaccine.
Yes.
You
It's
can
originally
make some
built as
choices.
a Western
And
fortress.
there's-
That was
Well, if
part of
anything
the
happens to him, I'm
Wild West thing.
I never.
Guess what?
Well, son, that's the way it is.
You're a
Way it
partner.
is.
You're a
I had a
partner.
friend.
You know, I'm not there. He goes, well, I'm gonna call you. I go,
Oh, rodeo.
I couldn't even find him.
I used to come here and write.
He went into the hospital.
Thank you, you're welcome.
Thank you.
He would have been like one of those guys that throws.
No, I found it was, there was a fire. And
But
the Fallbrook Fire
He's been
Department
through, he's
was
been through enough.
Yeah, that sounds like a lot of
right
that.
next.
Yeah, so this, you know, the good news is his rhythm schedule is normal.
And finance
Well, you know,
reasons, I
he's
don't know.
cognizant, there's 5 minutes, you know, what's going on.
Before
There's
years,
things
the
to
whole
get out.
Western Fort,
And,
they had
well,
cowboys
I'm
and
hoping
shootouts. The whole
it's going to be
reliving that scene.
something.
Oh,
But I
yeah.
said, look, there is a lot, but what they'll do is just
How you
put a
doing?
schedule here, so when it's a roller rooter,
That's
or
very
whatever,
important.
sneak it.
That-
Yeah, yeah.
How's it going? Good to see you.
He said that- that's-
Good evening, sir.
When they left, I was like, I wish I could be right.
Yeah.
I just laid on the couch and cows down.
Every
2
other
hours.
show.
And the cats like, oh,
Huggies.
and I said, it's like that, like this. It was like,
How are you?
so,
Thank you.
I have a few things for you to sign, so get yourself acclimated.
It was good to have them together. I think that we had a music recorded right. My first year.
I was gonna say, maybe that's the way of him getting their attention.
That's right. You know, I was glad just to get them all.
Yes.
Yeah.
I felt it was 21, 22.
How did your new year begin? Good beginning to the new year.
Rolling right now.
Yeah. Is it still not?
You have to do it press right.
I was gonna check to see.
That's the best part, being virtual.
Boom for the boom for the.
Let's see here, nothing to see. Move on, move on.
All right, she's in.
Oh, you got her over there.
We've had some feedback.
Yeah. It's.
It was because of this,
Okay.
but the little icons from us for translation.
She's in.
He just scooted out for just a second.
Scared him away with my nose.
He's got 5 minutes.
He's got 5 minutes. Well, I never could, so if you hit my one. Okay.
Good, 'cause you took mine too.
I've never been able to see.
I did.
And that's what she was talking about. She's like, and I was like, the world is there. And if the world is
The
there,
world has shown up.
then the interpretation will.
Okay, gotcha.
Howdy.
You got tons of paperwork today. All kinds of
Sign
stuff.
those.
Okay, these are signed?
Yeah.
Perfect. Thank you. Give those back. Yeah.
Sometimes they would come up with outside team incident. Oh, pictures.
Just have to sign and date.
I do love them. Yeah.
Fallbrook.
Roger, okay.
Well,
Hello. Come join us.
Sorry, Susan, you don't get the cheap seats.
yes.
Okay.
Talked about history of fall.
Another one?
Railroad will be in it.
And you'll fill this out.
No, I saw that. And I tried to print it.
Oh, there you go.
And you're gonna fill in the library.
It'll be fine. And it's good to learn things like that.
And then we can do that.
So it's the new.
It is, so.
You have one child.
It's all relative. It just has to be right.
A little bit on the older side, but there's still.
But they're still buying boys in.
Everything expensive.
I'm sorry. I don't know what to say. No, that came out completely wrong.
Found
Yeah.
those skills. Almost good. Almost good.
Okay, she's supposed to send them to you, like, for me,
She started out.
I'm trying, I was just trying to like.
I did. Well, actually, that was.
Request.
What is your sentence?
It's two daughters.
Oh, two daughters.
The other one, she's, her teacher driving license, so she got her EMT cert, so she's.
Where did she go for that? Where do we? Yeah, yeah, I have that.
I'll send you information on it.
Switch it up.
That's like.
Yeah, there's like.
Kinda like Harvard.
Wonderful.
And her younger sister watches that with interest.
Yeah,
How she launched
she kind of wants to get into medical field, so she's. Last week.
I went to both of them.
Yeah.
No, she didn't do them.
Oh, yeah.
I just have them all.
And they just had a New Jersey. So.
Yeah.
Well, her undergraduate, her lower division units would be a nice time to incubate her idea.
Yeah.
Because that gives her the picture of the next level of study. Followed by all of the science.
That could easily happen.
Yeah, I try to tell her.
I'm trying to miss you, okay, Mike?
You know what?
That's right. And then there's this future health professionals at Cal State San Marcos, I'm sure it's SVSU, which is really nice because the upper graduate students are in there. Into the lower graduate student. That's good. That's the best.
Sure.
That we're rolling our faces with that shiny face.
Alright, I'm gonna go ahead and call this meeting to order, January 11th, 2023, Board of Directors meeting for Fallbrook Regional Healthcare District. If we could have a roll call to establish a quorum.
Director Leach,
Here.
Director Jeffries.
Here.
Director Brown,
Here.
Director Maraz,
Here.
Director Stanislav.
Here.
Thank you. We have quorum.
Awesome. Let's go ahead and do that pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Can I have a motion to approve the agenda?
So moved. Second.
Any discussion?
We actually don't need to do
The roll call?
because
Okay.
you're all here in the room.
Awesome. Do we have any public comments from anybody in the audience or online? See,
Nothing online, and I did not receive anything via email, and the generic email did not receive anything.
awesome. Go ahead and moving forward. We have a presentation for from Foundation for Senior Care. So
Well, that
excited
came
to
up
take a
quick.
look.
Let's just get started.
See, Patty, I told you we'd get you right in the front.
Well, hello, everyone. I'm Patty Sargent. I know I've met many of you, but not quite all of you yet. So I thank you for giving me the opportunity to come in and talk to you and tell you a little about the Foundation for Senior Care so that hopefully when you leave tonight, you know something more than what you came in with. So I'm also here with Roger Shaver. He's our board president.
Sure.
All right, so just a few seconds of history. We were actually established here in 1979 as a nonprofit. We were the original hospital auxiliary when the hospital was here and raised money for all hospital equipment. So we've been around for a long time. In 2002, we made a focus on seniors and disabled adults. So since that time, we have kept maintained that focus, and that is what we do today. We now serve between 1,000 and 1,400 seniors and adults with disabilities every year. And I'll tell you how those programs, what those programs are, and in what way we serve. So our mission is to provide programs and resources enabling seniors to live a healthier life, to age in place. More than 85% of seniors want to live in their own homes and not be put institutionalized. So our goal is to help them have that meaningful life at home for as long as it's safe for them to do so. Next slide. Sorry for all the words. I'm going to recap these because many of you probably can't see it. So seniors age 60 plus make up, as of the 2021 survey, 26.5 of the Fallbrook 92028 and Bonsall zip code area. So more than 1 in 4 citizens in our community in the health district are seniors. By 2034, that number of seniors over 65, for the first time in history, will exceed the number of children 18 and under. So it's an exponential growth rate for seniors. 43% of our district seniors have at least one disability, and 25% rate their health as fair or poor. So it's, for many, it's a pretty daunting prospect. The healthcare needs, food insecurity, housing, which is growing, a big growing problem in our community. Transportation and other obstacles lead to poor health outcomes for our seniors. This statistics a couple years ago, it's probably been out for a while, but I was shocked when I read that more than 100,000 San Diego County residents have dementia or Alzheimer's, and it is the 3rd leading cause of death in our county. Each year, 3.6 million people in the United States do not obtain medical care because of transportation issues. And those missed appointments and the delays in healthcare cost the health system $150 billion each year and result in poorer health outcomes. So there is a great need to fill the gap for some of these things so that seniors, we have the best chance possible to help them overcome obstacles. And we do that, go ahead to the next slide, by offering these 5 services. Transportation, we have an adult day program, which provides also respite care for the caregiver. Senior care advocacy program, a door-through-door or hospital-to-home program, and computer and phone classes. And I'll give you a little bit of information about each one. So our Caravan and Expanded Rides program is donation-based. We ask a $10 donation for a local ride or a $45 donation for a ride anywhere up to 55 miles away for a healthcare appointment. If the rider cannot afford it, we give them the ride anyway. We currently have a program with Travelers Aid San Diego where they, it started a year and a half ago, where they will now reimburse us the rate of that donation for any qualified low-income senior. So we are able to tell the senior, no, you keep your $3, you can keep your $10, keep that for something else, your ride is covered. Because even low-income people who don't have the money to pay, they want to give you the money. Mm-hmm. So now we just say, it's covered, it's paid for, don't worry. We provide about 5,000 rides every year. And these are just local rides. We provide another 600 plus rides using a volunteer team in their own vehicles to provide rides out of town for medical appointments. During the COVID, the peak of the COVID crisis, we had call after call after call of seniors, how do I get food? We're running out of food and I don't want to go out. So we started a grocery delivery service then. We continue that service today. The volume is much lower than it was at the peak of the pandemic. We have 2 wheelchair vehicles and 2, so we have 4 vans, 2 are wheelchair equipped and 2 are passenger vans. And we provide about 250 rides every year for wheelchairs. And it's the same requested $10 donation as any other ride. And these rides are generally over 300 individuals each year. So we have a lot of our senior population that ride with us 2 or 3 times a week sometimes, to the post office, to the bank, to the grocery store. We're always looking for volunteers. So if anyone wants another volunteer position, our volunteer drivers just, we put them on a list, and when there's a ride request, we send it out and say, can anyone do this ride to this location on this date and time? And whoever can take it, they get back to us and we fill that ride. Okay, go ahead. So Jan is one of our longtime caravan clients. She has macular degeneration and lost her ability to drive several years ago. She says, without us, she said, there are so many things I would have to do without. She described how she couldn't get her package for her nephew's birthday to the post office unless we came and took her. She couldn't get to the bank unless we take her. And she's fairly isolated. So she admitted sheepishly to me, well, sometimes when I'm lonely, I just call Maria to talk to her for a few minutes. She said, you're my sister's there. So Jan is one of our special clients who we see every day, and transportation is so important. Our adult day program is a 9 to 4, Monday through Friday, day program for anyone who needs caregiving during the day. Sometimes this is a spouse, sometimes this is a parent, and the adult children are trying to work. So we have probably 80 or more % of our clients do have some form of dementia or Alzheimer's. The others, we have Parkinson's diagnoses and stroke clients in there. So we provide caregiving. Every day we do exercise, brain health, games, and music. We have a nice little courtyard where we can walk people around. We do Tai Chi, chair Tai Chi, all different types of exercises. And they have a great time. They make friends while they're there. We call this the club. So you will see in things that we send out in writing, it will be called the club, because they all say they're going to the club. And this is where they go to see their friends. We give rides to and from if they're, actually, I was gonna say if they're local, but we're now offering rides once again to and from the Temecula Senior Center for clients that are up there. And we have one that we were riding to and from San Marcos. We are the only adult day program. I believe there's one in Hemet, and then the rest are Encinitas and South. So, and Sheila, I always love the quote, the difference here is love. She goes on vacation, she's one of our caregivers, goes on vacation and looks at other daycare places when she's on vacation and does tours. And she comes back and says, Patty, you will never find anywhere else like that, because what they don't have is love. This is Jack, one of our daycare clients. He came to us originally, then went away and came back because they moved out of town. His wife, Diana, says, the club has been a lifesaver. And she said, quite honestly, it saved our marriage. Because usually the call we get is, I'm exhausted. I don't know where to turn. I need to do something different. Can I try? And Jack we love him. He is an intelligent man, great conversations. He can't remember 2 minutes ago, what you said 2 minutes ago, but just a wonderful conversationalist. And he participates in everything. And Diana has gotten her life back where she can go and take care of herself during the day when he's with us. I'm sorry about all the words here, so I'm just gonna talk through this also. So aging in place, helping seniors to be able to age in place in their own homes, as long as it's safe to do so. Health and wellness, and then providing guidance and information is what our care advocates are all about. This is a program that most people do not understand and have no concept of the impact that we are making. This is also where most of those 1,000 to 1,400 seniors every year are being helped, is through our care advocacy program. So we do home safety checks. They will go in and look for fall risks, remove rugs, push furniture out of the way, look for grab bars, recommend raised toilet seats, whatever is needed to keep a person safe in their home. We provide free durable medical equipment, so walkers, wheelchairs, raised toilet seats, shower chairs. If there's ever a need of that in the community and somebody can't get it through their insurance or they don't have money, they can come to us and we give it to them. Also, lots of adult diapers. We do wellness calls. We use volunteers for that to check in on isolated seniors and those that might have a complex health situation where we can just call and see how they're doing. And then those volunteers let our advocates know and they follow up. We give caregiver referrals. And up until 6 months ago, that was our #1 thing that we would do. People would call us for a trusted caregiver. In the last 6 months, that has changed to housing. Housing is the #1 issue that we deal with today. And then on the extreme end of this is case management. Our senior care advocates all have a background and a degree in either social work or human services. Case management is done in tight collaboration with Adult Protective Services, the Sheriff's Department, Fire Department, YANA, and any other resources, usually sometimes dozens of resources. This is typically when a client is either, a senior is either self-neglect or fraud, financial abuse, or physical abuse. They get involved, so they'll work closely with APS. Our phone rings constantly with APS, either calling us or us calling them, and we refer both ways. But our job is to help stabilize. So we will get, if there's no food in the house, we get them connected to the food pantry or the Fallbrook Senior Center to get meal deliveries. If they can't afford to pay their bills and the lights are turned off, we work with SD&G to get an extension and find a way to help them pay that bill to get them stabilized. We get them to mental health practitioners, to doctor's offices, to court appointments. And my advocates have been known at times to do somebody's laundry because there is no other way. Or they take them to a thrift shop and find them the clothes that they need to be able to move on. So our job is stabilizing them. And usually we have 80 to 100 of these cases each year. So at any given time, we might have 8 to 10 or 12 case management cases that our advocates are dealing with. Health and wellness, we assist with insurance, physician changes, insurance changes. We will help get a client set up with telehealth. We've set up our conference room and help somebody in there to have a private place, and we'll do it, set them up with it. We make many referrals to mental health providers and to physicians. We do nutritional assessments, and we hook people up with a mobile food delivery with the food pantry. So we do the assessment and then they set up the delivery. We were very involved in all the COVID testing that the district did. And before the district was able to get their vaccinations in, we partnered with Champions for Health and got them to do vaccinations in the seniors' apartment areas. And then guidance, we assist with all of the national and state entitlements. So Social Security, Medicare, Medi-Cal, VA. We work a lot on housing and landlord assistance, getting people, trying to prevent evictions, overcoming, do mitigation with landlords to try to negotiate and get them to work with us to keep somebody in their home longer until we could figure things out. Or we work with the county on different resources. We provide lots of information about transitions to assisted living, skilled nursing, board and cares. And we have trusted legal and financial advisors that we can put people in touch with. And then we're always doing education from the advocacy program. Okay, no problem. Go ahead. Donald and Craig. Donald has been one of our clients here on the left for probably 10 years, uses transportation and advocacy services. And he was over time, over several years, getting worse and worse in his health and having more and more needs. He finally, we found out at one point that he had a couple of nephews in the area that he'd never told us about before. And we were able to reach out to Craig, the gentleman on the right, his nephew. And in one of those rare circumstances, Craig stepped to the plate. He stepped up and came to help take care of his uncle. And those two now have a very close relationship. They often come into the office together because Craig will help him with something. And that was nowhere. He had no relationship before we pulled him in and helped him to understand the needs of his uncle. So they're helping each other now. Door Through Door is our partnership with North County Fire. The goal of Door Through Door is to reduce rehospitalization and the need for emergency services and to reduce falls. So this is where we do a lot of our home safety inspections. We get a referral from North County Fire and we go, we make a phone call, find out where the client is at, if they're still at home. I mean, if they've already been to the hospital and home, or if they are still in the hospital. We try to engage if they're still in the hospital and make sure that they are not discharged without appropriate support. Because many times it's a Friday night, the hospital wants them out the door. There's nobody at home to take care of them and they make that discharge unless we can stop them. And we have succeeded in doing that many times to either arrange alternate care or just give another day, give us one more day to find some care. So we really have made great strides in helping to helping people to have the resources they need when they come home from the hospital. And sometimes these aren't even hospital visits. If the fire department looks around and says, they need some help here, they'll just do a referral, even if they don't go to the hospital, and we'll follow up on that. Go ahead. And then we offer computer and phone classes. This is using your facilities at the Wellness Center. So this was, I think, our opening day here, I think, at the Wellness Center. Every Friday is a free Fix It Friday. If they have a phone or a computer issue, they can bring it in, and they bring in whatever instructors they need that know what that, are familiar with that, and they help them for free every week. And then every couple of months, we do a new series of classes. Go ahead. Our funding and our support, it is through grants and the support of like the health district and other grantors. That is still today our primary source of funding. We continue to keep looking for other sources of sustainable funding. We're constantly talking to other people and trying to get other generations of funds coming in. But otherwise, we are supported by donations, our day program fees, which is the only program that has a fee, through our fundraising efforts, and then through partnerships such as the Traveler's Aid that I talked about earlier. So just wrapping up, we provide that compassion, the connection, and community. That's what we're about. That's what's important to us. is to helping remove obstacles to better health and health outcomes. And we use volunteers, and we're just always asking people, whenever I do these talks, I say, you may not need this right now. Tomorrow you may run into somebody that does need it. So please be aware and just refer them to us and we'll get them to the right spot. So a big thank you for the support you've always provided. It makes the difference for us doing our job. We could not do it without the funding support that you provide. So questions?
So, with regard to the grants that you get, what other agencies are helping to support your program?
Locally is Legacy Endowment. They support it. Scan Health Plan is a supporter. Staples Foundation has provided support some of these years. I think those are the bigger ones, and then we get Angel Society. They are usually helping us when we have some sort of major repair work or something like that. And then there's a scattering of the smaller ones that, you know, it might be 5,000 here or 3,000 or 7,000.
Okay. Follow-up question. You made some references to Alzheimer's and dementia services that you're providing. Do you work at all with the Alzheimer's Association of the county, or?
I have not. I don't know if my daycare administrator has worked with them. I know we use their resources for, you know, education and for learning things, but I don't have a relationship with them.
Mhm. Okay. And last question from me, if that's okay. Do you work at all as far as sharing resources at all with the other healthcare communities that are here in the Fallbrook area, the nursing homes, the assisted living?
I'm not sure about sharing resources. We share services. So we provide transportation for Divine Path. So the vocational training program. So we're giving rides for their clients. We give rides for Rain's clients. With the food pantry, we have a more formal relationship with the food delivery service, home delivery service. And then like let's see, what else? Those are the ones that come to the top of mind, more
Okay.
shared services than shared resources. So I don't have any staff that is allocated to more than one organization.
Okay.
Patty, you might want to mention the fact that the advocates actually support and do a lot of work at the SNF.
Yes, well, yes, our
yes.
advocates, our advocate resources, doesn't just our resource list is more than 1,200 organizations that we either refer to or work closely with. And if we talk about individual resources, that's more like 3,000 people that we have in our database. So we work closely, like I mentioned, Adult Protective Services is a very close collaboration. Again,
What kind of
it's not a-
responses are you getting from APS when you make a referral to them?
Hmm.
Yeah, okay, that's what I figured, okay.
In the beginning, it's okay, but it only goes so far.
Mhm.
And when it gets turned over to the sheriff's department, almost all of them are dropped because it's not, it may be a senior's whole life savings, but from a county
They're looking at just the
sheriff's
dollars.
department, it's little
Mhm.
and it's not worth the time.
Okay.
So we don't get very far. Legal Aid Society is often used and it just doesn't go far.
Mhm. You good? You
Oh.
bet.
I was going to ask you if you have a good working relationship with the medical groups in town.
Yes, yes.
So they order your services and they interact with you and.
Yes, it could always be better. I've been saying that we've tried to get in there to do an in-service with like Braybell last
Send them a
year.
bill. Send them a bill. You'll get their attention.
Yeah, it's hard to let them to get an in-service, to get time to go in and talk to them, but they have our brochures, they know about us. We probably 50% or more of our transportation rides go to Braybell.
Mhm. Well, there's
Good thing. Go ahead. Yes.
Quick question. Given the funding today and that bubble were to grow,
Mhm.
would you expand existing services more broadly? Or is there services that you're on the list you can't do that need to do as an urgent need for the community?
Both.
So those both.
Housing is the hardest one, and there's not a lot we can do other than if there, there's now through the county, the supplemental, got $500 a month for support, housing subsidies that they can now do that is just starting a pilot program. That will help a lot of seniors, and we've already got names on the list because we have a relationship with the Office of Homeless Solutions. So they've already put our clients on their list before they're accepting applications. Housing is a big one. Our adult day program, we would love to do more there. I talked to Rachel, we just started conversations with Gary and Mary West Pace, because we would love to be an adult day health center and be able to accept insurance, which we've never been able to do. But we don't have a medical practitioner there, and we don't have rehab services. So there's certain things we need to do that we can't do. We could physically, we have room, we could do it, but we don't have the staff or the funding to do it. We also have had a lot of 2 or 3 people in the last 6 months that have called asking for scholarships for our daycare program. And we can't do it now because we don't have enough funding to do it. We have one person on scholarships, but we don't have enough funds to do the rest.
Thanks.
I've used these services several times for 5 different seniors in our community, and I can attest to the amazing work that's done. But I did want to make note that in your narrative, you touched on several social determinants of health, which is one of our guiding compasses for prioritizing our resources: food insecurity, housing, transportation, access to healthcare, and socialization. And we've all been reading about the deadly epidemic of loneliness in our country now. And you do die from loneliness. So this is a very compact point of care in our community that really encircles that. And I just made some notes. I just wanted to make that observation.
Yes. Do you have a question also?
Anybody else, or?
Good.
Okay, I don't really have any questions, but I did want to just kind of commend you guys. I really like the way that you guys utilize the volunteers and the way that your organization collaborates with pretty much everybody in town. I think
everybody.
That's a great way of doing business, and again, I think that the program that you guys are running with us in the Wellness Center seems like that's getting a lot of people out, and it's definitely a need for seniors in the community, and I think it's a great program. So I wanted to thank Patty, you and Roger for coming out. We definitely appreciate it. I wanted to thank Rachel as well. I asked Rachel to, get more presenters out for us to see kind of more of the grant recipients and kind of see what is going on in the community and see like kind of some of the impact of some of these programs. So first meeting.
Off we go. Well, we knew we might have some relationship that we could arm twist on.
And I do want to say the 5 times have been on behalf of seniors, not for myself. I realize after I
Well,
said
the day
that.
is coming, I'm sorry. But
There are 5 different seniors who needed help, so I really had to clarify that. Put me off the board, so thank you.
Yes. Well, when I started, I said maybe by the time I'm done that you will have learned something new. Did any of you learn something new?
Absolutely.
Thank you.
Yeah,
Thank you.
Thank you.
Thank you so much for having me, and if you don't mind, I'm gonna stay here for the rest of the meeting.
Awesome. Thank you. Thanks for coming out. See where we're at. Go into consent. Have a motion to approve the consent items.
Make a motion.
Any discussion on that?
Was that Mike or a second?
I was Terry for the
Terry,
second.
thanks.
No discussion. Go to a roll call.
Director Leach,
Aye.
Director Jeffries.
Aye.
Director Brown.
Aye.
Director Morales.
Aye.
Director Stennison.
Yes.
Thank you.
Moving on to reports, Finance Committee. Got the report.
You bet. Alrighty. Shall we-
Here we go.
Okay.
Have an issue here.
All right.
Just as they're getting that together, Terry, I just wanted to thank you for taking the role as treasurer, and we're definitely excited to, see what you guys can do in the finance committee here in the upcoming year. I know Jennifer has a ton of experience in that field, so it'll be great to see you guys work and see what you guys do
Awesome.
in that area. So.
Sounds good. Thank you. Okay, so we're looking at the October, November period, transition from October to November. Our liabilities and equity as of the end of November, $11,674,908. Compared to October, that's an increase of $704,177. And that's primarily due to the larger than expected and budgeted tax revenue that we received for that period. Total net income for the month of November is a positive $678,878. And that again is in large part due to the getting our share of the tax revenues for that period.
And you can find that at the bottom of report 2.
Report number 3, profit and loss versus actual. Based on the approved budget, the district is over budget in year-to-date net income by $143,052, and that was helped along by the fact that we got our revenue in November. There's been no change in the operating budget that we have already approved for this period. The LAIF account statement posted no interest for this particular period. It's a quarterly posting, so it isn't due yet. The cost value is $1,667,359 with a fair market value of $1,635,281. The performance rate for the month of November was just over 2%. Cal Trust, the cost basis, average cost amount for this account is $5,747,912. We earned $10,442 in dividend income this month, and an unrealized gain of $34,320, bringing the portfolio's total value to $5,558,885. As of November, the 1-year yield on the medium-term fund for these funds are domiciled was 1.16%. Is this where I'm supposed to talk about this?
No, this is just the compliance report that we put in the packet each time, just indicating.
Okay, fair enough. The district accrued a tax apportionment of $748,316,000 for November. The check detail report is coming up.
Yep.
And any questions with regard to that particular report? I know we talked about a number of the things at the finance committee meeting, but there was nothing significant in my mind
No,
during the review.
all were in the budget and expected to be paid.
Precisely. The visa statement is pretty straightforward. We reviewed that and didn't find anything extraordinary going on there. The community funds investment report for November This report shows that the utilized funds invested in the community health and wellness, and specifically for the development of the property, including maintenance, repairs, permits, and consultants. Any questions with regard to that?
I do have a question.
Right.
Is this our last payment to Taylor Design?
No, I don't believe so. We still have, construction documents, but we won't have that until, design elements are finalized. They will be doing the presentation on the meeting on the 21st.
Thank you.
I would have to go back and look to see what's left in the contract.
Thank you.
But it's within the contract.
It's still within the
Yeah.
contract, for sure.
Thank you.
And for this fiscal year to November, $112,044 of community funds were used. And under disclosures, the investments of the district are in compliance with the district's 2022-23 investment policy. The balances in the district's investment accounts give the district the ability to meet its expenditure requirements for the next 18 months. Are there any other questions on the finance report?
I would just say, could you go to the next document that you had up previously? This was an important part of our conversation, I think, about the audit.
Absolutely, this is a good time to bring it up. Well, we reviewed it at this month's meeting. This report that I'm giving, unfortunately, is actually November as far as the operating numbers, but we had a robust discussion with regard to our auditor's report or lack thereof. So we can either discuss that now, or we can have this discussion item after we finish this report. It's up to you.
We can go ahead and discuss.
Let's
right now,
elaborate.
That's fine, yeah.
Well,
Absolutely.
I'm a newbie here, but I've got to tell you, I've got some heartburn over the fact that we still have not got our CPA audit report in our hands. Our fiscal year end was last June 30th. We should have had that report in our hands by September, or October at the latest.
Mhm.
And it's the CPA firm with whatever issues and excuses they have. But in my mind, it puts us at risk. In addition to that, we have this report that has to go into the state controller's office by the end of this month. And we cannot do it without those numbers.
Mhm.
So I guess I'm just ringing the alarm bell.
So what do we do to remedy this?
Well, we had some discussions at the finance committee meeting. You want to touch on that, Rachel, at all?
Sure, both Susan and I have been reaching out to the auditor, and as you indicated, they've had several challenges within their firm. We received a final list, hopefully a final list today of outstanding documents they wanted. I sent half of it today. Susan will be in tomorrow. We'll send them the other half tomorrow. At this point, we're so deep in that we just need to get finished with them. They understand that this report is due on the 31st. So I think that there's going to be a mad scramble to try to finish the management report that we still typically have to write. So Susan and I have been in contact with David Foreman, who is their principal, several times before post-finance meeting today, just continuing to push.
So I want clarification on something. We had asked at the finance committee is if they had everything they had requested. So I want to be very clear that these new requests that have come in are new requests.
These are new requests.
Okay, and I would suggest a letter go out to them that specifically says, this is what you said you needed. And these came in at the last minute, some sort of documentation that shows that we were not remiss, because I know we weren't. So I don't know how you feel about
Well,
that.
I'm good with that.
Yeah, nice little COA.
Yeah. And this is
You
the
know, that's
final,
the same term that I used in the
Yeah,
finance
COA.
committee meeting.
Yeah.
Exactly.
and this is, as we also discussed, this is our third year with this team. And we rotate out every 3 years. So believe me, we'll be spiraling out and hopefully find another qualified firm that won't put us in the lurch.
So Susan and I had a conversation about that. We'll start putting together a short list of potential firms to have them put a proposal to us as well.
Okay, yeah, I mean,
As much as we can do.
I'm not sure what else we can do at this point. Yeah, I mean, hopefully they can get that to us right away. And if there's anything else we need to do on our end, like, yeah, we'll definitely get after
I guess
that.
the only thing that I would expect out of them is a commitment to, we will do our best, or we will try to have it to you by the end of the month or whatever. I mean, just to respond to their new request for additional documentation. That sounds to me like nothing more than, would they have requested that stuff had we not rang the bell?
Yeah,
Yeah.
I mean, that's,
Well, I think they started stepping up when you said we had the January 31st deadline. Oh, I wasn't aware that there was a deadline. This is response. And so
and they're professional auditors for state agencies.
Oh,
That's really unacceptable.
The challenge is that this firm in our first year was absorbed into a larger firm. And then the second year, we gave them a little bit of grace because there was some small changeover. And then this year, we lost our primary investigator, her backup. We have all new people on their audit team, and it has just gotten ridiculous on how slow it has become. So
Okay,
we
well,
don't.
make sure they see Betty Yee's,
Oh,
letter.
that was forwarded directly to them.
Yeah.
That's not a problem.
I did not see any place where, in Mrs. Yee's letter, where she threatened us in any way if we weren't filing a report on time, but I suspect there's gotta be some consequences of some amount to some degree if we don't have that done by the 31st.
Sure.
Let's make sure that we pass that along to the CPA firm.
Yeah.
Yeah.
Unless it's going to jail, and I'm not going to jail.
You don't look good in those
I don't think we're
plastic
worried about
things.
jail, but
Yeah.
we'll definitely talk to Jeff a little bit more before that comes up.
Sure, but all joking aside,
Right.
it's really bothered me since I discovered that we didn't have a report.
Yeah, absolutely. Just a question on that. Does the contract with the auditor typically have like a deadline in it?
It doesn't have a deliver by date typically in it.
Yeah.
There's generally I'm off the cuff here, but it's generally an expected, it will take about this much time.
Yeah,
And we are more than double past that now.
yeah. Maybe, to just kind of attack this issue in the
For next
future, if we could put some sort of deadline or kind of make it clear in the contract that we have this, filing deadline, and if we don't get it in time, then I'm sure.
And
it
it's
makes it
not
lot
a
harder
unique
for you
deadline
guys.
just for us. This
Yeah.
is a
Yes, it's
standard.
Yeah.
Yeah, we ought to be able to expect to have the audited report to us within 90 or 120 days after the fiscal year,
Yeah,
assuming we've got them what they've asked for.
yeah.
Right.
Well, when the contract comes, I'm sure it'll go to the finance committee and, I'm sure that the board will take a look at whatever recommendations you guys have for the contract and kind of go from there.
Fair enough. That's all I have for the finance committee report.
Thank you. Okay, next we have Teresa, Wellness Center.
Well, thank you. As I was preparing for tonight, I realized I normally roll in my report from public engagement and government into the board meeting. I think that was the report with the holidays. So I think you saw a lot of stuff in the December report that is in here. So I was just going to fill you in on some of the things happening right now in January, and then we'll get the December and the year at the next board meeting, going through public engagement first. So January, we are off to a start with 72 different events the public can come to. I'm sorry, 56 public, a total of 72 events and 16 private. So a lot of the things you've been seeing, a couple of new ones, a fun one that's there this week is Good Dogs. So we've had Labradors around the property that have been trained primarily as service dog for autistic children, young adults.
And so they're getting paired with the family, and the training is happening at the wellness center for these dogs with the parents to then go bring them back to the families. So the graduation is tomorrow, and it's open to the public, so it might be kind of fun. Might be able to help that nonprofit out too with getting, their name out in the community, but that's been a fun thing. Later this month, we have a group called RX Dance that's going to be starting, and that is happening on the 31st. And that will be ballroom dance for neurological and cognitive difficulties as a form of therapy, particularly for Parkinson's. It's a big one. It can also be for dementias. So we have a certified integrative health coach, Shannon Moss, that has started to do some programming for us, and this is her gift to the community. So it is, she is going to be teaching a kitchen makeover class. She is also doing a Sugar 101 class, and we're trying to all tie that in with our bigger picture of bringing our diabetes program, our lifestyle change program, to the community. So a lot of the workshops and education we do this next year, the goal is to make it a lot around lifestyle change. So it kind of all supports. It can be an internal referral into the diabetes program, and we have an overarching theme. So that is our goal as we're looking at our workshops. Hope Clinic is possibly going to be holding another event at our property. They aren't large. They don't have a large enough facility in their building for some of the things that they want to do. And so they've had some trainings, and it looks like they're going to have some again this month. So that's kind of nice to be able to support our other partners in the community with space. The training for the lifestyle change program is going great. We were actually told, and a lot of this is because of Bianca and the work she's put into it has been above and beyond. We're ahead of all the other organizations that are part of this county trial. So we just had our latest one with them, and we're putting together our workflow and our recruitment for the program, and our latest meeting with Skinny Jeans. So they've been kind of guiding us and then giving us our homework to go back and do. This past month, when we put out the email for January, we got a lot of nice comments from the community about the diversity of the programming we're offering. That it seems like there's really something for everybody and a lot of different, resources available. So that was nice to hear. And this is probably in Rachel's report too, but we did hire our community health navigator. So we are resource, yes. So new, we gotta get the title right. So she has been hired. So that's really wonderful. Our spaces, if you drop by, we almost have our new office suite. So we'll all be together, be able to build that team and have that space available. So later this month, we will be moving in to occupy that office space. And that's also in preparation for when the remodel happens to, like the main building, the community rooms. So that's what's going on for this month. So I don't know if you have any questions.
Jennifer?
When I saw the January calendar, my eyeballs popped out. It was so amazing, the diversity. I love seeing that the drum circle has a home again. That's been such a cohesive point for a certain group of folks, and I'm glad we're supporting that kind of socialization and community building there. What time is the doggy thing tomorrow?
4 o'clock.
4 o'clock.
Mhm.
And on the RX dance, RX ballroom, traumatic brain injury as well?
Probably neurological conditions. So yeah, I would think
Okay.
so. I would reach out to them or have someone reach out to them. Their contact information is on our website, and just, review it with them. And I don't know the cost yet. So there will be some cost to the participants for that program.
Because an outside provider is
Correct.
using our property. Got it. Okay, beautiful.
Anyone else? Awesome. Thanks, Teresa. That was a great report. I also wanted to thank you for giving me a good tour. When I went down to the facility, it's really looking great. I'm sure that the new board members, it'll be nice for you guys to kind of get a tour and kind of see some of the progress that's been made out there. But I would agree with Director Jeffries. Some of those programs that you described sound like really awesome programs. It's really great to see the facility utilized like that for sure. I would just be also interested with Bianca taking this training, that pilot program. It seems really exciting. I would be interested in maybe when she's done with the training, coming back to the board and giving us a little bit more information about some of the stuff that she learned and some of the stuff that some of the ways that the program is going to benefit the district.
We probably will be prepared at the end of February for
Awesome.
that. So I don't know, if I'll look at the dates, if it would be February or March, we could do that. We're hoping to, the goal date to launch the program is April. We were hoping for March, but I think it was wishful thinking. So that we would actually have a cohort starting is the goal, is in April. So in February, we'll both go through training provided through Skinny Jeans Project as lifestyle coaches.
Awesome. Awesome. Great. Well, thanks a lot. We appreciate it. Next, we have Rachel's report.
Again, most of my stuff gets talked about. We are still doing COVID testing here on Mondays, the Wellness Center on Thursdays. Just want to remind folks, as we're seeing more surges, that testing is still happening. Through the partnership with California Public Health, we were able to receive a number of new rapid test kits. Teresa and I are working on a plan. Probably we will hit the February or early March timeline to have these test kits delivered to our high density apartments in the area and or taken out to our agricultural growers, which typically have less access. So we'll get those distributed from the state. Regarding Taylor Design, as I mentioned earlier, they will be here on January 21st, and we'll do a presentation of the cost estimates from the two different general contractors that they've received. So they'll present that as part of that workshop.
Okay.
Okay. Regarding our grants, now that Raquel is more up to speed, we'll start doing more site visits with the board members. So you'll get more opportunities to see Foundation for Senior Care, their actual facilities, as well as some of our other grant sites. That'll be especially important for the new board members, because I think you're going to be introduced to some amazing nonprofits that we have in the community. As Teresa mentioned, we did find our new community resource navigator. So Katia Elizonda Marquez was our candidate, full bilingual, very immersed in the mental social health services part of the world. She is earlier in her career, which is great. We don't have any bad habits to break. So we'll be bringing her in on February 1st. The expectation is that we will take probably the first month or two, depending, to make sure that we're getting her trained and resourced. Again, this is a brand new position. So for her to have all the resources in line and set up and introduced to all of our community partners will be very important before she's really working with our client list. Board portal. Yeah. Sorry. We're all a little excited. So the Chromebooks are decommissioned. So Jennifer, I think you, Bill, do you still have yours?
Yeah.
I think you too. Barbara, do I still have yours? So if you
have mine.
You have yours. If you guys will just bring those in, we're gonna decommission them. The challenges we've had since day one of them not necessarily printing or connecting through OneDrive, it's a disaster. Through Streamline, which hosts our website, they have a separate component where now you will go to the website, you'll click your board portal, you'll log in, you'll have access to your webmail, all your board packets, historical documents, everything you need from any device that you're on.
Nice.
So we'll do a very quick, easy training on that at the January 21st workshop as well. It's very easy, very easy. You're gonna love it. Oh my gosh, you're gonna love it. We've been playing with it here. Regarding budget and chart of accounts, finance team, we have started to have a deep discussion about making sure that our chart of accounts more closely aligns with how the district does business now. Our old chart of accounts, basically, if you look at our P&Ls and such, you'll see that there's a lot of line items that don't truly fit with what we do here. They are historic. So we're going to reset these. We'll be moving to QuickBooks Online at the start of the new fiscal year. Not that we have much of a choice because they're moving you to online. But this is a perfect time for us to reset that. So you're going to see a few different things that will be coming to the finance meeting as draft in February for those new line item names. Good. So just letting you know, you're going to see some new stuff. Reminder, January 21st is our board training and strategic planning workshop. Jeff will get to keep you super bright and alert with his Brown Act presentation. Shaking his head like
That's
that.
his brown egg face.
Right. We'll have a review and discussion of some of the community health contract grant budget and priorities, discussion of community health and wellness center priorities, and board training on the portal. And that's all I got on mine.
Any questions from anybody on the board? I appreciate it. Great report. I wanted to commend Rachel. She's done a lot to modernize a lot of the processes that we've had here and some of the, it's nice to see her attack some of that finance related stuff. So great job. Thank you. Jeff?
Good evening, everyone. Chairman Leach has asked a number of important legal questions. Bill, what would you like me to go ahead and review the answers and take any questions as we go along? Does that sound right? Okay.
Sure. So just real quick, if I could just kind of maybe provide a little bit of context here. So Jeff's kind of talking about, I had some questions regarding it's item G2, the discussion of the wellness center budget. So obviously we're developing the wellness center at the board workshop. We're going to be getting the presentation from Taylor Design and some cost estimates for what's going to cost for their design plans. I basically asked Jeff to kind of go over some of the parameters of how we can use the money. Being a public agency, there's a number of rules and regulations regarding how we can use it. Can we hold on to it? How it can be invested? And I know that there's a number of potential pitfalls out there. So I definitely wanted Jeff to kind of re-educate the board and give us all the information possible regarding, the rules regarding spending the money before we kind of got into a bigger, I guess, budget discussion.
Perfect timing.
So Jeff, do you want to take it over?
Yeah, that's fine. Thanks, Bill. The first question that Bill asked was how is the district allowed to spend money under the law? And so I kind of like to describe healthcare districts as creatures of the legislature. They were created, overseen, and can be dissolved by the legislature. And consequently, the expenditure of district funds is subject to both constitutional and statutory laws. So we have a provision in the Constitution that requires that public funds must be spent for a proper public purpose and not to expended to benefit a private corporation or private individuals. Funds that aren't spent for a proper public purpose are viewed by the California courts as illegal gifts of public funds, and the individuals, which are you guys, okay, responsible for this expenditure could be exposed to personal liability. So we have to be very careful when we're dealing with public funds that they go, for proper public purposes, and it's a purpose which is related, for which the district was created. So in our case, it's got to be healthcare related purposes. Now, you could turn to the health and safety code, and what qualifies as a health related purpose is very broad. It can be funds for healthcare facilities, for hospitals. It can be wellness and prevention programs. It could be providing funds to organizations that are necessary for the maintenance of good physical and mental health of communities served by the district. This is a really very broad range of purposes that as a healthcare district, you're authorized to expend public money, whether it's whether we receive it through our taxes or through the sale of the hospital, the original hospital. So because you as a district board are a legislative body, courts generally give very good or great deference to your decision as what constitutes a health related purpose. Now, Bill also asked is what are the potential pitfalls here? And as I say in the opinion, while the courts give deference to decisions of legislative bodies like yourself, the expenditure must meet this public purpose test, or again, the expenditure could be an illegal gift of public funds, and individuals responsible could be for the expenditure could be held personally liable. Now, in addition to that, AB 2019 was passed in 2018, and it really relates specifically to healthcare districts. And the Assemblyman Aguilar was concerned about grants and how the boards as very special districts that didn't operate hospital, how they were expending these public funds. So she along with Curry authored this AB 2019, and it requires all health care districts to post on the district's website the district's annual policy, which happens to be coming up after this, for providing assistance or grant funding. And there's a number of things that Aguilar purposely put in the bill. Now, the good news for us is we developed this grant policy a number of years ago, and it was patterned after Grossmont's policy. And Aguilar liked the Grossmont policy, which is very similar to Fallbrook's policy. And she basically patterned these requirements very much after the Grossmont and Fallbrook policies. So a grant recipient must meet specific grant contract terms and conditions, and there must be some monitoring by the district, and reports need to be provided periodically so that the board understands what's the money's being properly spent. And the district has to have a plan as part of their policy for distributing these grant funds each fiscal year, which you're doing. And so there's a process for providing, accepting, and reviewing these applications. There's a prohibition. This was one that we really fought over at the time that this bill was passed, and we tried to get changed. But there's a prohibition against individual board members meeting regarding grant applications with the grant applicants and district board members, or even staff outside the grant award process. And the effect of this is that she felt that it was a conflict of interest for board members in particular to go out and meet potential grant recipients and say, hey, we got this grant program, we want you to participate in it. What do you come to the board? We didn't agree with this, but she put it in the statute anyway. So except for helping for helping on technical issues, if somebody's having trouble with respect to filling out the grant, we're really not allowed to go in there and solicit grantees. So this is a bit of a problem with the current statute, but nevertheless, it is, we have to, we have to follow it. The other thing is the grants need to, if they go to, they need to meet the needs of underserved individuals and communities. That's in general, they like to see that in these grants. Also, if you've got multiple grants, which we do, there's a goal that's in the statute that says you need to prevent more than 50% of your grant funds from being awarded to a single grant recipient. You got to look as part of the grant to protect the public's money. Part of the evaluation, you need to look at the financial needs of the grant applicants and also their ability. That's why we look at their financial capabilities in addition to their needs, that this is a solid organization that we're putting money into. And whether or not whether organizations do not provide direct patient care, will be eligible for grant funding, and if so, under what criteria. Again, I think these are things that are incorporated in our policy. Finally, we can have sponsorship. Sometimes organizations will have charity events and things like that, and so you can also cancel or consider grants for those charitable events. And then the last one is to you can have foundations, for example, that might be related to the hospital. It's controlled or associated by another organization. But as long as it's the safe harbor is the idea that they're a 501c3 nonprofit organization, and they're providing services or programs that assist the local, the constituents in your district. So he'd asked a question about, can the district hold the funds in perpetuity? And while there are no specific legal restrictions on the length of time in which a healthcare district can hold public funds, I think over the last decade, there have been potential legislation and legislative investigations that would have significantly affected the ability of healthcare districts not operating a hospital to hold and expend healthcare district funds. And back in 2012, AB 2014, or 2418 rather, this was the Gordon-Dickinson bill, and it was introduced in reaction to some things that were going on in Northern California with healthcare districts that didn't operate hospitals. And it would have required healthcare districts to expend 95% of their annual tax revenues on the operation of healthcare facilities or the performance of the district powers under the existing laws. So basically, it only was going to allow 5% to go to overhead expenses, and everything else every year would have to go to, either supporting a hospital or other things that were allowed to under the law. So they felt that the authors of the bill didn't feel that the hospitals that were, our districts that weren't operating hospitals, they were carrying too high a reserves. Okay, and they didn't understand that in some of those cases, there was a potential that those leases could terminate. They'd have to take back the hospital, and they needed those reserves to be available. And I won't go into all the details, but this was the case even for Fallbrook for a number of years. There was a reserve fund that they looked to in case the hospital, they had to take the hospital back. And in essence, that would have really severely restricted the ability for healthcare districts to accumulate reserve funds. Fortunately, the bill died in assembly and it hasn't come back. We were able to fight off that. So, examples, another question was about, examples of districts that have had legal difficulties surrounding either their investment or expenditure of public funds. And, I don't know that, for those of you that are older, you might remember the Orange County debacle and then bankruptcy in 1994. And that basically caused the legislature to pass and amend the government code section, which regulates the investment of surplus public funds by public agencies in California. And actually, pretty much that we have an investment policy that we adopt every year. We review it every year. We make sure that we're following the conservative investments that are allowed, so that we don't find ourselves potentially in a situation for that many special districts and public agencies were facing after the 1994 Orange County bankruptcy. So there have been some incidences that on the expenditure side, you may all recall the city of Bell was involved in a serious scandal involving the misappropriation of public funds, and people went to jail, and that was a real problem of graft and corruption that ran through the city of Bell. So there have been some concerns, or I'll give you some examples that over some healthcare districts that don't operate hospitals having too large reserves. Peninsula and beach cities have each had unrestricted funds of over $50 million, and the local county and the state investigated it. There was grand jury investigations, and there's been some examples or scandals over the year that felt that certain healthcare districts weren't managing their assets properly. And Mount Diablo has been the subject of grand jury investigations and LAFCO recommendations to dissolve the way they've expended their funds. And that actually lost Madonna's healthcare district was dissolved last year over the expenditure of too much money on what the legislature viewed as administrative costs, duplication of services, and not effectively tracking the grant program. So, we have to always be aware, and I think we've got a pretty good, fairly good policies in place. So it's a lot of information, and I'm happy to answer any questions you might have.
Do we have any questions from the board?
Mr. Scott, will you be attending the workshop?
Yeah, in person.
Thank you.
Anybody else? No. Thanks for the report, Jeff. It was definitely some good information. I think that it definitely kind of provides the framework of, there's a lot of regulations governing how we can spend the money. And that's both with the grants and with, the greater investment policy with the wellness center. And there's a great amount of fiduciary responsibility that we have as board members to be really careful with the public money. It's tax dollars that we're using, and just really think thoroughly through it and make the best decisions possible for the taxpayers.
Yeah, thank you, Bill.
And so thanks to Jeff, we're going on to discussion and possible action items, and definitely some of that information that we got from Jeff will be kind of applicable to some of these items coming up. So G1, Rachel.
Well, speaking of grants, this is our annual renewal of the district's community health contract grant policy. While this is new to a couple of you, it is the same policy we have reviewed consistently over the years. We make sure that it is in compliance. Really what we just need for you to do is, again, approve this policy. Nothing new to it, nothing of discussion really, but it has to be reviewed and approved before we can actually start the grant application window, which is February 1.
Alrighty, I'm guessing everybody's had a chance to review that. Can I have a motion to approve the grant policy as written?
I move approval of the grant policy.
I'll second that.
Do we have any discussion on the policy as written?
I would like to have for consideration a discussion at the workshop with regard to involvement of our grant recipients in specific activities that we will be having during the year at the Wellness Center. And when we have our meetings. I've been sitting on this board for 13 years now. And we have some phenomenal people who are doing tremendous things for our community. And I would like to have them have the opportunity to showcase what they're doing without making them feel like they're mandated to perform, because we would just like to show the growth. I mean, for example, you know, the range therapy program initially was given seed money many, many years ago. And look what they evolved into. It's phenomenal. Foundation for Senior Care. God bless us. We are so fortunate to have them. And what they do, they literally are, I would say, gerontology 101. Because everybody goes, what am I going to do with my aging relative? You know, and you're the first resource that they go to besides the doctor. So I just a topic or a way to have a conversation, to have them more engaged, welcoming them to be partners with us more visually for the good of the community. I'd like that to be one of the topics for.
We have that as a part of the grant guidelines and budget priorities for conversation. Is your request changing anything in particular to the policy, or just to support furthering that conversation at the workshop?
Just support furthering the conversation, because I
Okay.
know as the policy is currently in play, there's no requirement demanding them for participation.
There actually are some participation requirements in that policy. That's pretty spelled out. We discuss it when we do the grant training.
Right.
But we can definitely talk at the workshop about adding and providing different opportunities.
We're just
as well.
growing and they're growing too. And I want a wider field of vision, if you will. That's all. Thank you.
Thanks, Director Mraz. I would definitely agree with that. I think we've had a discussion about getting more of them out. I think that it's really good as a board member when you see some of the organizations come out and they talk about how the funds are used and some of the impact that it makes. So I would just, emphasize that again when you're doing some of the grant training. If you could just let them know we're interested in hearing more about their stories, and it'd be great for them to come out and give us more information about that for sure.
Boys and Girls Club is another one. They're
Absolutely.
really new to the program, just a couple of years, and what they've done is phenomenal,
Yeah.
just phenomenal.
And I think it'll be good this year for a lot of the board members to get out to site visits. And I think that that's a good opportunity to kind of get that conversation started and to kind of develop some of those relationships. And, as a board member, when we're trying to figure out how to spend some of that grant funding, it's great to be able to go back to knowing exactly what the impact is. And so I definitely agree with a lot of that. So that's it. We'll go ahead and take a vote.
Director Leach,
Aye.
Director Jeffrey.
Aye.
Director Brown,
Aye.
Director Morad,
Aye.
Director Stansel.
Aye.
Thank you.
Next up, we have G2. It's a discussion, I guess, a preliminary discussion surrounding the Wellness Center's development budget. Rachel or staff, do we have anything on this to start out, or?
No, this was just a brief conversation you and I had about wanting to make sure that there were opportunities at board meetings for the board to be able to discuss different components. So we didn't really have any backup documentation for this.
Okay.
I know that we will be obviously talking a great deal more at the January 21st budget or workshop. So if you have anything specific that you want to bring forward from this discussion to that, I think this was just to lead on to that.
Okay. Okay, well, I guess I'll just kind of start the discussion. This kind of came up, for me just because, I talked to Rachel and I know that we have the, cost estimates coming in. Those will kind of get presented to us here, on Monday for the development of the wellness center. In the discussions that I had with Rachel, I guess kind of fleshed out that the board's never, had an exact, policy as far as what the budget is for the development costs over there. In my personal opinion, being a board member, I've always kind of thought that the budget was the money that we had in the development account that was from the sale of the hospital. So that's always been kind of my idea of what the general budget parameters are for that property over there. You know, so that's kind of, you know, wanted to bring that discussion to the board as a whole in a public meeting, just so that everybody can kind of maybe speak their piece, you know, give their opinions on that. I think that we'll have, as a board, more information as we go into the next meeting next week, so that we can kind of see. I think everybody's had a chance to see some of the greater, I guess, design elements of what Taylor Design put together. But I think it's really critical for us to kind of look critically at the cost and some of the benefits that the community is going to get from this project. In this discussion that I had with Rachel, I don't have the paper in front of me here. I'll have to look at it, but I had Rachel basically bring me up a breakdown of the costs that we've spent at the facility over there so far, overall on construction and on top of that consultants and some of the different projects. And I don't have the exact numbers again, but I want to say it was about $250,000 that has been spent on actual construction costs and like brick and mortar improvements over there. And to this point, it was 700,000 plus spent on consultants and design elements and trying to figure out what the community wants and different reports, you know, regarding some of that. And I just kind of think at this point, as a board, it's going to be critical for us to stop kind of kicking the can down the road and looking for more, I guess, reports and more questions. I mean, I think we've asked the community a lot of times what they're looking for. We've done a lot of research on what are the unmet health needs in the community. And I just kind of think it's getting to the point where it's going to be time for us as a board to critically evaluate some of that stuff and make big decisions on how that money is going to get spent. So that's kind of my piece. I'm not sure if anybody else has anything on that. Terry?
My thought is that it's gonna be difficult for us to have a real clear cut idea of a budget without being sure of what our real vision is for this project.
Yeah.
I saw the fact that we spent a lot of money on asking questions, getting consultants in and that sort of thing. That was a lot of dough that was spent on that. And until we really have a clear vision of which items, which services we are going to provide under that roof, only then will we know what we're going to ask the community to do RFPs on for services, requests for proposals. So until we really sit down as a group and come to a firm understanding of what our vision is for that project, I don't know that we can get too much nailed down, both with regard to our services we're requesting, you know, bids on or
Yeah.
hand out for, and then how much we're gonna spend on the project.
Yeah. Just, I mean, I guess in response to that, from my perspective, I think we've kind of done a lot of these reports. Maybe if we can kind of get some of that, some of those help need reports over to all the directors, but some of the cost and some of this consulting stuff has been kind of like, what are the needs? And this last report, what was the?
Yeah, so I provided the catalyst reports to
catalyst.
both Mike and to Terry, which
Okay.
was the most comprehensive that we've received last.
Yeah.
And I'm not asking for any more reports or. any
Yeah,
more
no,
studies.
understood.
I'm not-
No,
I'm not gonna go there.
I'm trying to, like, that catalyst report was basically, kind of designed to kind of give us an idea of what sort of programs that are unmet needs in the community as far as help.
Did they give that to us in golden box paper?
Yeah,
That was an expensive report,
that's a sentiment that I definitely agree on, and, you know, I definitely share that opinion, you know, full-heartedly. So, you know, I think that at this point, like, we've spent a lot of money on trying to figure things out. You know, I leave it to staff to kind of give us more information on some of that and provide some of that for some of the new board members and whatnot, but
Well, as long as we're good at relying upon that particular, the catalyst document as a beginning place. I'm not asking for anything else to be done, but that ought to be our guiding tool of
Yeah.
what our vision is gonna be for that project. And
Yeah.
whatever's left over, then we're gonna be wanting to spend money on the outside. That's kind of how I see it.
sure. Yeah, well, I think that, and it'll be interesting to see some of the cost estimates and whatnot next week, because basically that Taylor Design was supposed to take that report, use that report to basically show them how to design the facility for our uses in those sort of programs. And so it'll be good for us to kind of see what that cost looks like. And then I think that it'll kind of give us a little bit more clarity when we see that, and we can see, hey, this element's gonna cost X, and this is gonna cost, you know, so that we can kind of figure out, and as a board kind of decide, hey, this is what we think is a priority, you know, so that's really my piece. Jennifer, do you have anything?
So you're bringing it back to building Fraser School.
Awesome, yeah.
You come to a point, it's like shuffling the deck. You have the content that you've done your best to know, what do we want that school to be able to do? In this case, what do we want the wellness center to offer? And now we're going to get the physical plant information, and we're ready to shuffle the deck and play the game, which
Yeah.
for us is really a vital hub for our community, right? So I'm in total accord with, we are ready for that kind of moment. And what we haven't had before that we have now is the community, through booking our wellness center up to this point, what they want. We have that data now. We've never had that kind of grassroots organic. This is what we would like this health center, community and wellness and health center to be able to do. So I think we're really ready to know. I'm looking forward to hearing about the facility projections, because we have a finite amount of money. You know, it's $5 to $6 million. And also to remember that we've had a thought relative to, let's build that site so it's an income revenue generator too. Because that full purpose, the current sanctuary, if we do that right, it will become an income generator for us. There are so many people in this town looking for places for reunions, for graduation. They're always asking, and there's no place to go. So I agree with both of you. We are ready to go. There's no more need for information. We've got what we need.
I'd like to contribute that with all the information that we have acquired, and where we've had our goals and our objectives and our mission statement have all been, shall we say, stunted by the COVID, the impact of the COVID situation. I would like to see the direction of the board and the community to move into here and now and let's get it done. I know that there are always going to be something that's going to pop up. It's like raising a child. Something's gonna happen, but you gotta get across the finish line till they're 18. But the bottom line is, we are in a position that we can be proactive instead of being reactive. And maybe our focus can be current for this year and the next year, or maybe the next 2 years. I'm tired of waiting. I'm just anxious, and I think everybody is. And I think it's time now to move forward. We have a beautiful facility. We could revive our health fair. We used to have a health fair each year, and different entities would come and participate, and we haven't had that for a while. And we've got the facility over there. We would have the interaction. I think would be good exposure. It's just a consideration. But the public, I believe, would come if it was presented in the right way. I think that what we're hearing from the Foundation for Senior Care and what they're dealing with, it gives us a whole new bucket of information with regard to our seniors. And the seniors are dealing with all of these issues with diabetes, blood pressure, mental illness, etc. We should partner more enthusiastically with our senior population, just on the focus of gerontology, because we're there. It's happening. Aging is a process. It's not a disease. And in that process, we can be expected to experience A, B, C, and D. And then this is my own personal concern. With so much information that has been put out with regard to COVID, the vaccinations, the studies, the aftermath, this and that, I would like to just put the information out there for our testing ability and let people make their decisions and talk to their own private physicians, because truly I'm concerned about risk management for the district. It's a slippery slope at this point because there's so many variables that are now coming to the surface. And I would not like to see us be put into a risk management stage because we participated, even though we're doing all that we can in good faith with the information that's provided to us from the CDC and all the others. We've proceeded with goodwill to educate the community. I think that we might want to just look at the testing element and then step back and let each individual take that responsibility on and refer them to their doctor or their pharmacy.
And I would second that, because that's what we've always been doing.
Yes, yes.
We have never been anything other than referrals.
Absolutely.
Thank you.
I just don't want it to go, anymore. Our staff has worked so hard during this COVID epidemic, the hours that they put in, and even if our people have suffered by getting it as well. So I would like us to just do a little more risk management on that, if you will.
Have we done vaccinations on our property?
Yeah.
So we've had vaccination
Yes.
clinics?
Yeah, we've had several through, for a long time, we were doing it with the county through CAL FIRE. And then we brought in Rite Aid Pharmacy team was doing that, and Champions for Health, the Fallbrook Family Health Center, those
Is
various
that where your
partners.
discomfort lies?
Well, my discomfort lies is with the fact that the physicians that have medical groups in the local areas are referring you to go to the pharmacy for your
shot.
shot.
Mhm,
That tells me hot potato.
mhm, mhm.
And
I thought that's where you're headed.
Yeah. And so there's plenty of information out there. Give them all the information they want, give them all the test materials that they have. Let them go ahead and make that decision on their own. to them and
So
their physician.
continue doing what we've always been
Continue doing
doing.
what we're doing.
Great. I fully support that.
Yeah.
Nice. Well, I think I would agree with some of that, but I think we're kind of getting a little bit off subject here. Mike, did you have anything?
Well, being a newbie,
Yeah.
but with a lot of history in program and project development and new product development. What I'm hearing described here is that you've done a voice of customer through the Catalyst report. You have the needs defined. Now it's time to put together the design objectives. And we're at that point, I think, where we're defining the must and the wants for this program to be launched. Once you have that, you define the scope of the project and the dollars and the timeframe. And I don't know if that exists yet, but that's the kind of thing I'd be looking for, is a timeline of X years with X deliverables at certain costs.
Yeah.
And I think that's where you're trying to get to, and I agree with that, where there's a ceiling here of money that we can spend.
Yeah,
And that's gonna drive your must-want line.
yeah,
And then you drive that through a program development process. So I feel like there's a lot of good work and understanding of the needs. Now we have to prioritize those with the limited budget that we have. And then frame that out so it's very visible and transparent.
yeah,
So that's kind of what I was hearing and all that.
yeah.
Okay.
I would definitely agree, and I think that once we kind of figure out some of the built elements, then that kind of will dictate like what sort of programming that we're able to put in there or whatever, so absolutely.
Okay.
I think that this greater discussion, again, we'll kind of push that more to the next meeting, and we'll look forward to getting some of those numbers and kind of looking at that, and then I would just close the subject with, like, I agree with a lot of you guys. I'd like to kind of get this project completed. I think that this is the board here to do it. And I think that when we're done, if we do it right, it'll be a amazing asset for the community that we can all be really proud of, and that the community and a lot of the nonprofit groups can utilize, and it can be a hub for collaboration and a lot of the stuff that we want to promote. So looking forward to more information and kind of continuing to discuss the project. Okay,
Let the work begin.
Get our Lincoln logs out here.
And if you don't mind, Bill, I can say G3, G4, G5 are essentially all one. Those are our two investment vehicles and then our bank account. And really, this is a little bit formulaic. What we need is approval and agreement from the board that we're going to change our signatories on them. Currently, Barbara and Jennifer are the only two signers, and it is historically our practice to have three, and Terry, as our new treasurer, typically would be that signer. So what I think we can do, if you're all amenable, is we could say that you're giving us approval to go forward with Leif, Caltrust, and Pacific Western to have Terry Brown added as the third signatory for all three of those accounts.
I'll second the motion.
Do you need a motion?
Yeah, somebody has to make that.
I'll make the motion based on what Rachel just explained, that we need to have a third signature, Mr. Brown, added to our vehicle so that we can execute our transactions.
I second it.
any discussion? Sounds good. Okay, seeing none.
Director Leach,
Aye.
Director Jeffries,
Aye.
Director Brown,
Aye.
Director Mirage.
Aye.
Director Stanislav.
Aye.
Thank you.
Thanks. I tried to make that as fast as I could.
Oh, thank you.
So we'll move on to G6. This looks like this the call for nominations for the LAFCO board. Do you have anything on that, Rachel?
No, other than what we put in your packet, it's more informational unless someone is super interested in sitting on the LAFCO board. It's always good to have representation since LAFCO does provide oversight to special districts and other municipalities. I would think that our board is still relatively new, fresh, and already busy. So unless you would like to nominate one of yourselves to sit on the LAFCO board, it's mostly in there for information.
I would just ask, are any of the board members interested in that position, or
Not at this
anybody?
point.
Stay down, Barbara. Stay
No,
down.
no.
Looks like
One of our brother
you don't have
or
any
sister.
nominations?
No nominations, not a problem.
Thank
you for that.
It's a fascinating body,
Aye.
but oh my gosh.
Yeah, absolutely.
You know what, maybe we ought to have Steve Abbott talk to us later on about LAFCO, because he could bring us up to speed, have us a guest speaker.
Yeah.
Maybe at our workshop.
Not at the workshop.
Okay,
Your workshop is full.
maybe in the future, in the future.
For sure.
Yeah.
Yeah, I'm sure Steve would be happy to talk. Yeah.
Okay, do we have any comments by members of the public on any items that weren't on the agenda? Seeing none, do we have any board member comments or any items for subsequent meetings? Director Jeffries?
Firsthand experience, we had a medical urgency in our household that required North County Fire to come with the ambulance. And what I wanted to say was, the sheriff's dispatch was fantastic. North County Fire dispatch, fantastic. The ambulance team plus the fire engine team, all 6 of them in the house, they were so filled with care, concern, and calm. And they gave my sister such grace because she was having a really hard time. And it was almost as if they enveloped her in this caring, right? And then off she goes. And I just wanted, oh, and I said to them, you see that thing on your ambulance that says supported by Fallbrook Regional Healthcare District? And they go, I said, I'm on the board. They all go, thank you.
Fair enough.
So it was a moving experience. It was a significant experience for us as a family. And I just wanted my board colleagues and others who are here to know how great that went.
Oh, absolutely.
So, and Palomar Hospital was fantastic, and the aftercare was fantastic.
I hope your sister's gonna be okay.
She's on the mend, she's
Good.
on the mend, so I
Good.
wanted to validate our good work out in the
Absolutely.
community.
Absolutely. Good.
Awesome. Any other board member comments?
This time.
Okay, awesome. I just make a quick comment, I haven't had an opportunity to talk to the board as a whole since we did the committee assignments, but I just wanted to say that I'm excited about the committees for 2023, and I'm looking forward to hearing your reports back and participating in the committees that I'm in. And you know, obviously as a board, a lot of the work that we do is kind of fleshed out in the committee forum. So I would just encourage all the board members to bring as much information to your committee as possible, and try to flesh out some of that stuff and bring that information back to the board, and hopefully we can kind of get a lot of things accomplished like that. So
Yeah.
Fair enough.
Thank you for your thoughtful tapestry that you put together.
well,
Thank you.
Yeah.
yeah, awesome. I'm excited.
One last thing, and it's just a boilerplate kind of a thing. We've had in place a policy to do our hybrid meetings, you know, online and that sort of thing. And that was all due, I presume, to the COVID nonsense, or the COVID event, sorry. With the governor's expected recension of the state of emergency on February the 1st, will we still, number one, want to continue offering that? And if we do, will we be in a legal position to do that?
Well, I can kind of speak for myself, but before Jeff talks, 'cause I prefer in person,
I do
and
too.
I would be all for, as a board, voting to go in person if that was, you know, legal, and that's what the rest of the people in the state are doing. You know, I would be more, I guess, you know, willing to discuss it if we had a bunch of people online, but I think consistently we don't really have anybody, so. Jeff, if you want to speak to that?
Well, yeah, I mean, after February 28th, we will no longer have this continuing resolution. Basically, will be going back to in-person meetings. However, every district and city are doing kind of a hybrid where they've kind of liked the idea of the public being able to zoom in and participate remotely, but it's really up to you guys. We can go back to exactly the way it was before the pandemic, and there are some new rules that allow for certain circumstances. If you're sick, or you've got some family issues that you've got to address, if you do have a Zoom platform, then there are occasions when board members, if things come up, can still participate at the board level and attend the board meeting, you know, remotely. But that's really up to you guys. We can do anything we want at this point, beginning particularly on February 28th.
Fair enough, okay.
Awesome. So I mean, I'd be open for that discussion as a board. We can kind of discuss that once that state of emergency falls off. And I'd welcome you guys' ideas and, you know, how you'd like to move forward. But before we move on to other subsequent items, I would just also, with the board workshop coming up, I would just challenge all the board members to kind of think about what your vision for the district is. What are some ideas that you have, you know, kind of really brainstorm and come to the meeting with some good ideas. And, you know, I'm sure that each of us has different ideas about how the district can move forward and make a great impact. And I'm definitely interested in hearing more about your ideas and you know, discussing with staff some of the things that we can do moving forward. So.
Fair enough.
Let's see what we have here. So we have some items here for future calendar. These are the committees and everything going there. We have the holiday on Monday, Martin Luther King Jr. Day, and we'll be doing that board workshop as well. So the next meeting is February 8th.
And then the workshop's the 21st, just for clarity, it's not on the holiday, it's the 21st.
21st.
Right.
Okay.
Just making sure.
Saturday.
Saturday, the 21st.
We
Is
set
that-
aside 4 hours for that, is that correct? 10 to 2?
Correct.
You think that's gonna be enough?
That'll all depend on you.
Yeah, okay.
Might have to have round two.
We can,
I'm just saying, I mean,
Yeah.
I'm all good to go, but.
There's a lot, there's a lot.
There's a
to-
lot of stuff to cover, yeah.
I've, in years past, they used to go to Paula Mesa, have a room, all the board members were there, and we were there from like 8:30 until 3.
Well, I'm free, you know, I think it seems like most of the board's free as long as we have food for the board and for all the staff and drinks and everything. I'm sure that we can
Food and content.
just figure it out and we'll work it out, so.
And there's no issue with regard to us being together in the same
No,
room?
it's an agendized meeting.
Okay.
So in my report, I talked about those main agenda items. So as long as any decisions that are made would have to stick to those agenda items. Open discussion can happen, you just can't take any action on anything that was not agendized.
And it's open to the public.
Of course.
Yeah.
Yeah,
Y'all
it's not
come.
closed session.
Mhm.
What are
Okay.
you serving?
You know what? We're very fortunate to have someone with event expertise right here. So she has discussed the menu with me and you'll be fed. And it'll be good. She's gonna make sure you've got some breakfast, some lunch, and some snacks. So we'll make sure your blood sugar stays high enough, you can participate.
Very good.
Awesome.
Coffee all day long.
Plenty of coffee.
Yeah, awesome. So I'm excited. It'll be good, you know, with the Brown Act and everything. I'm sure everybody will get the training on that, but it'll be a good opportunity in a public forum to discuss some of these things and try to get some sort of conclusion to some of the questions that we have. So that's it. So go ahead and adjourn the meeting. Thanks, everybody, for coming out.
Thank you.
Thank you.
Barbara, we're now together on the facilities committee.
Now we can.
Heaven help us.
Wait a minute,
So
Dr.
I'll see you
Ray.
next week.
Now, you know what,